Med History.
Smallpox is an infectious human disease related to particularly dangerous infections caused by the orthopox virus variola virus, characterized by fever, intoxication, and specific rashes on the skin and mucous membranes. The spread of smallpox occurs by aerosol, while the pathogen is so stable in the air that it can cause infection of people who are not only in the same room with the patient, but also in neighboring rooms. In the mid-70s of the 20th century, the complete elimination of smallpox in developed countries led to the abolition of preventive vaccination against this disease. The orthopox virus variola virus belongs to the group of animal and human smallpox viruses, is stable in the environment, easily tolerates temperature drop and drying, can remain viable when frozen for several years. At room temperature, it persists in smallpox crusts for up to a year, in sputum and mucus for up to 3 months. When heated to 100 degrees C, the virus in dried form dies only after 5–10 minutes. The reservoir and source of smallpox is a sick person. The virus is isolated throughout the entire period of rashes. Patients are especially contagious in the first 8–10 days. Asymptomatic and convalescent carriage is not noted. Chronization is not characteristic. The predominant localization of the pathogen in the human body is the mucous membranes of the oral cavity, nose, pharynx, upper respiratory tract. The release occurs with coughing, sneezing during breathing. The skin can also serve as a place of release of the pathogen. Smallpox is transmitted through an aerosol mechanism, mainly by airborne droplets and airborne dust roots. The aerosol with the pathogen is able to travel with the air current for a considerable distance, affecting people who are located in the same room with the patient and penetrating into neighboring rooms. Smallpox tends to spread in multi-story apartment buildings, medical institutions, crowded collectives. A person's natural susceptibility is high. Non-immunized persons become infected in the vast majority of cases. The percentage of immune persons is no more than 12 out of 100 unvaccinated, on average 5–7%. After the transfer of the disease, a stable long-term, more than 10 years immunity is formed. The last case of natural smallpox infection was described in Somalia in 1977. In October 1977, the last case of smallpox was reported. In 1980, WHO has certified the eradication of smallpox worldwide. WHO Committee on in 1990, he recommended as an exception that researchers working with pathogenic orthopox viruses, including smallpox virus, be vaccinated in specialized laboratories and in monkeypox foci. Despite the fact that smallpox is considered a defeated disease on Earth, it is included in the list of particularly dangerous infections, since the causative agent of this disease can be preserved in some countries in the arsenal of biological weapons. Currently, the causative agents of smallpox are preserved in 2 laboratories around the world, in the CDC, USA, and at the State Scientific Center of Virology and Biotechnology in Russia. Symptoms of smallpox. The incubation period of smallpox is usually 9–14 days. It can increase to 22 days. There are periods of the disease, prodromal, or the period of precursors, rashes, suppuration, and convalescence. The prodromal period lasts from 2 to 4 days. Fever, symptoms of intoxication, headache, chills, weakness, muscle pain, lower back are noted. At the same time, a rash resembling an exanthema and measles or scarlet fever may be found on the hips and chest. By the end of the prodromal period, the fever usually subsides. On the 4th–5th day, a smallpox rash appears, a period of rash, initially representing small roseoles, progressing into papules, and after 2–3 days, into vesicles. Vesicles have the appearance of multicameral small bubbles, surrounded by hyperemic skin, and having a small umbilical depression in the center. The rash is localized on the face, trunk, limbs, not excluding palms and soles. Unlike chickenpox, the elements of the rash in one zone are monomorphic. With the progression of the rash, fever and intoxication increase again. By the end of the first week of the disease, at the beginning of the second, a period of suppuration begins. The temperature rises sharply, the condition worsens, the rash elements build up. Smallpox lose their multicamera, merging into a single purulent pustule, and become painful. After a week, the pustules open, forming black necrotic crusts. The skin begins to itch violently. On 20–30 days, the period of reconvalescence begins. The patient's body temperature gradually normalizes from 4-5 weeks of the disease. The pockmarks heal, leaving behind pronounced peeling, and later, scars. There are severe clinical forms of smallpox: papular hemorrhagic, smallpox, draining, and smallpox purpura. The moderate course is diffuse smallpox, mild smallpox without rash and temperature, varioloid. In this form, smallpox usually occurs in vaccinated individuals. There are rare rashes that do not leave scars, and there are no intoxication symptoms. The source of infection is a person who has contracted smallpox. High contagiousness is noted during the first 10 days, however. The release of viral particles into the environment occurs during the entire period of the appearance of rashes. The asymptomatic course of the disease, as well as the carrier of the pathogen in this pathology, is uncharacteristic, as is the transition to a chronic form. The places of localization of variola in the human body are the mucous membranes of the respiratory organs, as well as the oral cavity. The pathogen is released with coughing, sneezing, and breathing. The infection can be transmitted from the patient by airborne droplets and airborne dust. Aerosol with pathogenic microflora is able to travel long distances, infecting people who are in the same room with a sick person. People's susceptibility to infection is very high. People who are not immunized are most often infected. After the disease, the formation of stable long-term immunity, more than 10 years, is noted. Of the available candidates for the relatives of the variola virus, monkeypox and cowpox are of the greatest interest. The first of these is a rare infectious disease that can affect both animals and humans. The main signs of monkeypox are general intoxication of the body, a high rise in temperature, and the formation of exanthema on the skin. The pathogen is genetically similar to the human smallpox virus. To date, there has been an increase in smallpox in monkeys. So in May 2021, an infected patient was identified in the UK, and 2 more cases of the disease were reported on June 2nd and 24. In the United States, on July 16, 2021, an American was diagnosed with monkeypox. All of them have been to Nigeria. Chickenpox is a highly contagious viral pathology, the causative agent of which is the viral infection, varicella zoster, belonging to the family of herpes viruses. The pathogen, with a decrease in immunity, causes a severe disease, shingles. Chickenpox mainly affects children. Most often, they have a mild form of the disease rather than in adults. Clinical manifestations of smallpox in monkeys. The duration of the incubation period is from 1 to 3 weeks. The onset of the disease is acute, accompanied by complaints of severe headache. There is a rise in temperature to high figures. The patient feels weak and chills. Lymph nodes located near the site of infection increase in size, become inflamed, and become painful on palpation. The patient complains of nausea, vomiting, decreased or lack of appetite, which is associated with intoxication of the body. By the 4th day, the temperature begins to drop to 38.5 degrees Celsius or lower. Rashes appear on the body, which go through several stages. Formation of a small spot up to 1 centimeter in diameter with transformation into a tubercle. The appearance of a bubble filled at first with transparent contents, which gradually becomes cloudy. The formation of a crust with the formation of a scar. At each stage, the temperature rises to high values again. In each of these periods, the patient notes a deterioration in well-being. An increase in lymph nodes is already noted over the entire surface of the body. Due to the appearance of rashes on the mucous membrane of the pharynx, the disease is accompanied by the appearance of cough, dryness in the pharynx. In the presence of a rash in the mouth, increased salivation and a feeling of discomfort during chewing are noted. If there is a lesion of the eyelids and genitals, then painful sensations appear in these areas. In the case of a purulent infection, the temperature rises, blood pressure decreases, the pulse becomes frequent, consciousness is disturbed. These signs indicate the development of infectious and toxic shock. Diagnosis and treatment of smallpox. Diagnosis of smallpox is performed using viroscopic examination, using an electron microscope, as well as virological and serological methods, microprecipitation in agar, ELISA. The separation of smallpox pustules and crusts is subject to investigation. From 5-8 days of the disease, it is possible to determine specific antibodies using pH, RSC, RTGA, ELISA. The treatment of smallpox consists in the appointment of antiviral drugs, metazone, the introduction of immunoglobulins. The skin affected by smallpox rash is treated with antiseptic agents. Additionally, due to the purulent nature of the infection, antibiotic therapy is prescribed. Antibiotics of the groups of semisynthetic penicillins, macrolides, and cephalosporins are used. Symptomatic therapy consists in active detoxification by intravenous infusion of glucose solutions, aqueous salt solutions. Sometimes glucocorticoids are included in therapy. The prognosis depends on the severity of the course and the condition of the patient's body. Vaccinated individuals, as a rule, carry smallpox in a mild form. Severe smallpox with a hemorrhagic component can result in death. Currently, specific prevention of smallpox is carried out in order to prevent its import from epidemically dangerous regions. The elimination of smallpox in developed countries has been achieved through mass vaccination and revaccination of the population for several generations. Currently planned universal vaccination is impractical. In case of detection of a patient with smallpox, his isolation is carried out, as well as quarantine measures are carried out against all who have had contact with the patient. Thorough disinfection is carried out in the focus of infection. Contact persons are vaccinated within the first 3 days from the moment of contact.